everyone, welcome to another interesting and educative episode of the Global Health Pharmacist Podcast. Today is World Health Day, and there is no way you can guess wrong what I'm talking about on the podcast today. I'll be making some things very clear to you about health without mincing words. World Health Day is celebrated on 7th April every year globally to mark the anniversary of the founding of the World Health Organization, which is WHO, in the year 1948. That's almost 80 years ago, right? The first World Health Day, however, was celebrated in 1950 after a unanimous decision by the 26 founding member countries at the time, with the aim of creating awareness about a specific public health issue affecting the global population each year, which is taken as a theme with campaigns globally. Over the decades, WHO has played a key role in raising awareness for major initiatives like the Smallpox Eradication Campaign, the Polio Eradication Initiative, and the fight against HIV/AIDS. It has also supported many scientific research for the treatment and management of many more diseases worldwide. Although in recent years, the organization has faced various challenges, with some countries pulling out, it keeps making far-reaching impact when it comes to global health. Having given you this background story, which has enabled you to know what World Health Day is all about, let me zoom in on this year's campaign. Without further ado, let's get right into it. You should think about your health all day, every day, all year round. Although I'm not saying you should obsess about it, but rather you should be aware of it. Make decisions and do things to maintain it. But if for some reason you forgot or you forget about your health or neglect it, today, World Health Day, serves as a reminder, a wake-up call, so to speak. This year, the focus is on celebrating the power of scientific collaboration to protect the health of people, animals, plants, and the planet. The campaign spotlights both scientific achievements and multilateral cooperation needed to turn evidence into action through a strong focus on One Health approach. And the theme for the year is Together for Health, Stand with Science, which is particularly interesting and exciting for me because it embodies what this podcast is all about: the use of science and research-backed evidence to provide health information. From the medication information series, to the disease prevention series, to the World Health Campaign series, to the drug discovery series, and global health conversations with FAMG, all these topics are intentionally curated to foster public and global health through science. That's my part as a qualified scientist and healthcare provider in fulfilling the mandate of this year-long campaign. What about yours? The theme is encouraging you as a person to trust scientific facts above hearsays and misinformation. It is telling you to trust experts that give you research-proven information and not people that just peddle stories about health without any authority to back it up. It is telling you to trust your healthcare providers and work with us to make our world healthier. It is telling you to partner with me on the Global Health Pharmacist Podcast and share the valuable information I provide with others, among other support you can give. It is telling you to take your health and that of others seriously. One major highlight of this campaign is the One Health campaign. I have talked about One Health on this podcast severally. It is a concept which recognizes the interconnectedness of humans, animals, plants, and the environment when it comes to health. You see, nature is actually a cycle. Remember the carbon cycle, water cycle, nitrogen cycle, and all other cycles? How what you give to the environment determine what you get back, and how these different components depend on each other for survival. The simplest example is how humans need oxygen, which is a waste product by plant photosynthesis, to survive, while the plant in turn needs the carbon dioxide, which is a product of human respiration, for their own survival. How waste from humans become manure for plants, and plants become feed for animals. Many zoonotic diseases, that is, diseases found in animals, can be transmitted to humans. I've spoken about Lassa fever recently on this podcast, whose primary host is the rodents. There's the avian influenza, which is bird flu, transmitted to humans from poultry. You could get food poisoning from eating infected plants. I can go on and on and on. One Health is saying in order for you to be healthy, your environment must be healthy too, including all living and non living things in it. There's no point treating malaria when you live in a dirty environment that breeds mosquito. You just get reinfected again. It's only a matter of time. It is an absolute waste of resources also treating a communicable disease which you could just contract again from your neighbor who isn't treating themselves or who is carrying a drug resistant pathogen. And you, as the neighbor, should know to stay away from others when you have such diseases until you have been properly treated. You should know to complete your course of antibiotics and not share them with others in order to prevent antimicrobial resistance. You should also know to only access care from qualified health facilities. You should get your medical advice and medications from qualified healthcare providers. The summary is this: health is a collective responsibility, and you must do your own part in order to ensure not only your health but that of others as well. Because at the end of the day, you'll be doing yourself and others a favor. Let's say doing others a favor is the bonus, since you'll be the primary beneficiary. Protecting the planet isn't just for environmentalists, it's a health priority for all of us. Therefore, this campaign calls on governments, scientists, health workers, partners, and the public to 1. Stand with science by engaging with evidence, facts, and science-based guidance to protect health. 2. To rebuild trust in science and public health. And 3. Support science-led solutions for a healthier future. There's a very high chance that you've heard the saying, health is wealth. Maybe you've even used it yourself. Now, take a moment to really consider it. As cliche as it is one of the truest statements ever. It is true for individuals, for communities, as well as nations. No health, no wealth. Literally. I'm sure I don't need to start explaining to you how I came to that conclusion. And that's all I have for you on today's episode. I hope you've learned a thing or two. Here are key takeaways. 1. Health is a non-negotiable in life, and your health is dependent on the health of your environment, which includes all living and non-living things in it. 2. Do your part in ensuring your health and that of others. 3. Misinformation is a major threat to public health. Only get your health information from qualified sources and people and listen to their advice. Lastly, remember that while medicine treats, science guides. Science isn't just for people in white coats. It's the foundation of a healthy life. So do not hate science. It's what brings a lot of health solutions to the various diseases that are in our world today. Do what you can to support scientists and share the right information with people. Please do all you can to desist from misinformation or spreading them around. Only direct people to the right sources of information, like this podcast. You can do your bit by sharing it with others so they can get the access to right information from a qualified healthcare provider. I hope this episode has taught you something important about health, especially One Health. And I hope that you can share it with others so that they can gain the same insights which you have. You know, this podcast isn't playing when it comes to giving you accurate health information backed by science in simple and clear terms. And it is not restricted to any country. It is global. People listen to this podcast in over 30 countries. And the aim is to go even further. Your support is what will help me to achieve this goal. Thank you so much for your support so far. I'm counting on it going forward. Like, share, comment, follow, and subscribe. Leave reviews as well if you can. All this help with visibility. I figured that the comment section is usually very dry. Maybe some people actually do not know what to do in the comments. So here are a few tips. You could ask questions about the episode, leave a kind word for me, reply people's comments, like them as well, and even share your experience as it relates to the episode. There's a lot to do in the comment section, guys. Use it. Please, when it comes to official correspondence, the email address is globalhealthpharmacistpodcast@gmail.com. If you send to the old mail, I may not get to it on time. Please take note. I'll see you next time. Till then, stay healthy and God bless you. Bye.